today. So I give you Carolina Rodriguez.
Hi everyone again. So I always say this is going to be a short presentation, and it's never a short presentation, so I'm not promising this is going to be a short presentation. I am thinking, though, that I'm going to go pretty fast on most of this slide. So one of the things that I always have to keep in mind is that we have obviously a lot of navigators who started with us from the beginning, from open enrollment. But as you heard today, we also have a lot of people that are just starting. And I always assume that all the information we've been learning throughout the month, meaning an entire year, and a couple of months now, that everyone remembers it. And, you know, I learned that that's not necessarily the case based on the technical assistance questions that I get and the cases that are reported and end up going to the state. So I figured that one of the things I could do is kind of do a quick refresher on specific considerations that you should be discussing with clients or keep in mind when dealing with specific clients. So what we're going to do is go through several slides, and I'm going to highlight specific populations and issues that have come up. And again, this is based on feedback and a compilation of case issues that you guys have submitted throughout the first open enrollment or the first year and going on into the second year. So, and then after that, we'll do some marketplace updates, and we'll wrap it up. So, this topic we've been talking a lot about recently. So when you have seniors who are going to be eligible for Medicare in 2015, and the scenario is usually husband and wife come in seeking for usually a QHP unless they're Medicaid eligible. But if they are looking for a QHP and one of them is going to become Medicare eligible, you want to make sure that they understand what's going to happen. So one of the things that they're going to have to do once that person becomes Medicare eligible is obviously disenroll from the QHP and enroll in Medicare. And they want to do that because if they miss the open enrollment Medicare period, then they're going to have issues because they've missed it, and then they have to wait. Some people have to wait almost a year, several months before they can get back into Medicare. The other thing to keep in mind is that if they are getting tax credits, once that person becomes Medicare eligible, they are deemed to have access to other health insurance even though they're not enrolled, so they're no longer eligible, at least that person, for APTCs. The other thing that became a big issue for this population was changing plans, going from a couples to an individual plan. And part of the issue was that you know, clients were not informed that if they do have to go from a couples to an individual's plan, that means that they're buying a new product, and any deductible that they had met with their couples plan is not transferring into the individual. So the conversation to have is, you know, what are your medical needs? When is the one person going to be Medicare eligible? When potentially would there be a switch of product from couples to an individual? Do they want to get a higher metal level and get a lot of services and have no deductible potentially? Or do they want to take a lower level and then that other person waits for Medicare? So there has to be a degree of conversation. You don't have to explore every hypothetical, and of course you don't want to complicate their lives by considering every potential issue that might arise in the future, but you definitely want to let them know that if they end up switching from a couple to an individual, which they would have to if one is eligible for Medicare, that the deductible is going to start fresh. The other big issue to explain is that if they are getting tax credit, once one of them, either husband or wife, becomes eligible for Medicare, their tax credit may be reduced, or they may not get any tax credit even though they're below 400% of the federal poverty level, right? So this was a big issue last year where we got a lot of cases in which families were below 400% of the federal poverty level. And of course, you know, in our minds, the general rule was if you're below 400, you are eligible for tax credits. That's not necessarily true. The tax credits are based on the cost of the second lowest silver level plan and the expected family contribution. So if the expected family contribution, which is based on household size and income, let's say is $3,000, 6% of the income, of whatever income, right? If it's $3,000, and now the cost for an individual plan based on the second lowest, it's $2,000. Again, I'm making up numbers. Then the expected contribution is covering that amount, and that family will not be eligible for tax credits. Again, it is very likely that if a couple who one becomes Medicare eligible is getting tax credits, definitely there will be a reduction in tax credits, and they may end up not getting any depending on their income. And the sad part, which I wish there was a little bit of advocacy on this part, is that premiums paid for Medicare are not included in the percent a household is expected to pay towards the cost of premiums. Because clients will say, well, I'm not just paying, like, let's say 6%, I'm paying more than that because my husband has to pay Medicare premiums. Unfortunately, Medicare premiums are not included. The only premium costs included are the ones obtained through the marketplace. So again, these are key points to discuss. Seniors 55 years or older, the Medicaid lien issue has come up again. So it's, it could be an entire presentation that would go into the details about it. Here's what I would recommend. Have the terms, so first of all, the client has to be 55 or older. So if you have a 40-something-year-old saying, well, I don't want Medicaid because of the Medicaid lien, then you can explain it doesn't apply to you. You have to be 55. So that's the first step. If they are 55 or older and they are concerned, you want to print out for them or have handy the terms, rights, and responsibilities. It's called the Request for Financial Assistance Terms, Rights, and Responsibilities. And I can send them around for you guys to have in a PDF file so you can print them out. On page 3, this is the language. I understand that effective April 1, 2014, which is when the law changed, if I get Medicaid through the New York State of Health, no lien will be placed on my real property prior to that. So that's another takeaway message is, well, assuming that your case was subject to a lien, there are very strict rules. It doesn't happen from one day to another, and if you're alive, it cannot happen. And recovery from assets in my estate upon my death is limited to the amount Medicaid paid for the cost of, and this is critical, nursing home care, home and community-based services, and related hospital and prescription drug services received after my 55th birthday. So I am definitely not an expert on those specific programs, but basically all those programs are referring to long-term care, skilled care, meaning these are individuals who cannot take care of themselves and need this additional assistance, whether it's in a nursing home or it's at home or a community-based agency that provides that assistance. Again, these are for people who need the extra help and are not, so to speak, independent living at home. And the key also is it says, and related hospital and prescription drug services. Those have to be related to the nursing home care or the home and community-based services. It's important to note that right now, if someone is getting Magi Medicaid, meaning Medicaid through the marketplace, you cannot obtain those services by mistake. You actually have to submit a request to the local Department of Social Services, HRA, in order to get those services. So another takeaway message for your clients is when you enter the possibility of a lien, like the lien land, you will know it because you are going to be seeking very specific services that through your managed care plan through Medicaid under the marketplace, you cannot just get. You would have to go through your local Department of Social Services and apply. And let me tell you, having had to transition one of those cases to HRA in order for a client to get those services, you will know that that is happening because it's a process. And again, you want to highlight that by mistake, they're not going to end up getting those services, that they would know it. And at that point, they really have to evaluate their options, right? For someone who's still concerned and they are falling under MAGI Medicaid guidelines, the only thing you can do at that point is explain their options. They either take Medicaid or they pay full premium. Unless their income, again, let's say the following year, it's above the Medicaid threshold. We've had some clients who were locked into Medicaid and are still very concerned despite our best efforts to explain the Medicaid lien language and the fact that they should not be worried about it. They don't want it. And so they have the option, obviously, if their income is below the Medicaid threshold, they can go ahead and seek an appeal to be disenrolled, and then they can pay full premium. And if the following year their income goes above the Medicaid threshold for their family size, then they can go ahead and potentially qualify for APTCs. And the last bullet point, obviously, that the state or LDSs would recover the costs that were paid for under the program. But again, this is long-term care. Clients through the marketplace are not just going to walk into it. It takes a lot of effort. We're going to be sending you guys some resources that you can hopefully provide to your clients. I think I already went over this information. Okay, families near 400% of the federal poverty level with children. They should try to determine with greater accuracy their federal poverty level if it is in question, right? If they over or under project their income, they may be asked for proof of income. So this is the scenario. There is potentially husband and wife or a couple, and they have children, and they are self-employed, and last year they made above 400% of the federal poverty level, and they're thinking that they might make a little less, so they may be under 400% of the federal poverty level, and they want to know what are their options for their children. Obviously, they would be getting a QHP, but the real question is, do they select a QHP and add their kids, or do they get a couples plan and pay for their kids' CHIP premium, if any, which if they're close to 400, there will be one, right? So you want to have a conversation of the benefits of Child Health Plus. For example, there's no deductible, but you also want to have an honest conversation regarding networks. So if a family comes to you and says, well, I've had Empire and my kid's pediatrician is within network, I think I'm going to be below 400% of the federal poverty level, and I'm going to be subject to having my kids on CHIP, you want to make them aware that the networks may be different depending on the plan that they select, and they should check with the provider, right? So now I've been asked, like, what happens if I overproject or underproject my income? So maybe you have a family that says, I actually want my kids to be in CHIP, Child Health Plus, it's cheaper for me. Well, the system, it may ask again for proof of income. So they can go ahead and overproject. If they want to overproject and the system allows them to go through, or they just have to provide proof of income, and then they can get a QHP, a family QHP, then that's not a problem. At the end of the year, if they end up making less than 400% and they were entitled to tax credits, they can just get it through a refund. So that's not an issue. Big consideration, again, is looking at what would be for those families who are potentially above the 400%, which at that point they can select a QHP or Child Health Plus for their kids. They want to look at what would it cost for a QHP for the entire family versus the cost for a couples plan plus any premium, potentially full premium if they're over 400 of CHIP. So, yeah. Those are things. So individuals who are separated but not divorced. I am pretty sure most navigators who have been doing this for a while have encountered at least one person who comes in and says, well, I am legally married, but I have been separated from my husband. I, in fact, don't even know where he's at. We got married 20 years ago, and I haven't seen him in 10, right? And your heart breaks because the rule is that if you're married, you must file jointly in order to get those tax credits. And all of a sudden, they're still married, but she's filing a single or head of household. There is one exception to this rule, and in order for this exception, the following requirements must apply. So this is basically, I'm going to read out the language that is in the rule. A married taxpayer who lives apart from the taxpayer's spouse for the last 6 months of the taxable year will be considered unmarried, meaning that they can get tax credits, if he or she files a separate tax return, maintains as the taxpayer home a household that is also the principal place, well, it's the home of a dependent child for more than half of the year, and furnishes over half of the cost of the household during the taxable year. And all this language basically says, if you have been separated from your spouse for 6 months, you file your own separate tax return, you have a dependent child who lives with you and for whom you provide half of the cost for that child during the year, then for purposes of the tax credits, you will be deemed to be unmarried, and you can get them without filing jointly. So hopefully that is clear. You sometimes have to go back and refer to this specific criteria to see if your client qualifies. So always look, you know, when you have a client in that situation who says, I'm married, but I haven't seen my husband, your question should be, do you have any dependent children, right? And do you file separately? And do you support your child at least for half, right? And if those are the questions, then they can get tax credits. This is the only exception. Do not get confused. If you do not file jointly and you are married and you do not fall under this exception, I'm so sorry, you're out of luck. You cannot get tax credits, right? In that case, they should really at this point probably try to see if it's at all possible for them to seek a legal separation or a divorce. From a practical perspective, this issue on the application has not, to my understanding, been fixed. So if you go through the application and you say head of household as the tax filing status, and you say that that person is married, it's not going to allow you to go through the application and get tax credits. The solution that we were told last year was to go ahead, you can still put head of household, but instead of married, you're going to put single. And on your case note, wherever you're giving your case note, write the client, based on the fact that they have a dependent, this is not a case note on the application. This is your personal case note. Just for your records, in case ever an issue comes to you, you want to remember that you gave whatever advice to the client based on that rule. So you want to explain that there is a dependent child and the applicant has not been living there, for the spouse has not been with the applicant, and so forth, just for yourself. Let me know if you have any questions as you encounter this client. The zero income individuals. Individuals who have no income and are asked to provide proof for Medicaid eligibility must provide the appropriate proof. If consumers were working and are now unemployed, and there is what is known as a wage unemployment benefit hit, they have to provide a letter of termination from the previous employer, and they have to provide a letter of unemployment or proof that they were denied for unemployment or have exhausted their unemployment, right? So someone may come to you and say, well, I lost my job, I don't have any income, so that's great, you go through the application. However, there is what the state calls a wage/unemployment benefit hit, which means that on record, on the system, there's income showing up, whether, again, it's from wages or unemployment. And at that point, to show proof of the actual income, you show the termination letter, which would show that moving forward the client doesn't have any more income, and you show the unemployment denial or benefit letter, which will show that for X number of weeks, the client will have X amount. So that's the way you prove or provide proof for individuals who may come to you and say, well, I no longer have income. And always remember that sometimes clients may assume that if they're not working, they don't have wages, they have no income. So you sometimes have to probe for unearned income. If a consumer does not have a wage or unemployment benefit hit, you can submit a statement from themselves or whoever is supporting them. I'm sorry, that is badly worded. For individuals who are not getting a hit, but they're still being asked to provide some type of proof, you usually want to explain how they're supporting themselves. They can write a letter if they're supporting themselves, let's say, for example, through credit cards, through a retirement, which depending on the retirement, they would have to document that. Or if, let's say, family is providing support, if it's mom providing support, mom would write a letter, and the letter doesn't have to be long. It can simply say, I am so-and-so, and I provide food and shelter to my son so-and-so, and they have to sign it and write down a phone number at the bottom. Note that there is this declaration of no income form where the person attests to have no income, but that is only accepted in very exceptional circumstances. And when that form is used, it actually goes to the Department of Health to be reviewed. So what that means is if you are using that form when you can in fact provide other proof, you're simply delaying the eligibility determination for your client, and it may not be accepted. At the end of the day, you're still going to be asked for some type of proof, again, depending on whether there is a wage or an employment hit. Those are things to consider. The self-employed. Many of you have raised, and today you guys have continued to raise the issue with how do you prove income for the self-employed, and you get different answers. You might call them the navigator line, then you might call account review, and you still get different answers. So it's very hard. Again, we're going to see if we can all pitch in our ideas and come up with some lists. First thing with those clients, you have to reassure them that you do not need an exact figure if their income fluctuates. So the self-employed would usually come in and look at you like, what do you mean I have to project my 2015 income? I don't know. I don't know what I'm going to make this week. I don't know what I'm going to make next month. So just reassure them that you will need a figure as a starting point, and they can always go back and make an income change on their application. For eligibility purposes, the marketplace uses the income on line 37 for the most part, which is the adjusted gross, and that's on 1040. They obviously, under the modified adjusted gross income, there's other income that goes back in. For example, if a client is receiving Social Security benefits, the full amount comes in, not only the taxable. On Schedule C, whenever you have someone who is self-employed, so this is usually the scenario. The client is self-employed, they come in, they of course cannot come up with a figure. You look at their taxes and you look at line 37, and they may or may not agree with that amount. And they will argue that that's not what they make, because as self-employed, they make a lot more, or they may rarely do you find that they will say that they make less than that, unless this year is different, right? So what you want to do is go to Schedule C and see their expenses and gross income. And you want to use that to guide yourself to be able to determine an accurate number for 2015 projections. And I think once you show the client Schedule C and where you're getting your information, it really helps them understand or walk them through the process and have a better sense of what they think they're going to be making for the future year. Let's see. And for self-employed, remember, when you're doing the application, you're going to have to include or do that 3-month financial form. And then they may still ask you for proof of income. Okay. So the healthy, low medical care usage consumers. So consumers who are generally healthy and have little medical needs and are not eligible for CSRs may consider silver versus bronze plans. Make sure that they understand the basics of the 2 metal levels, deductible, co-pays versus co-insurance, right? in some plans, especially like the standard plans, you will have co-pays, which is a fixed amount. In the non-standard plan, you may have a co-insurance, which is a percentage. You want to make sure, and especially in the Bronx plans, you usually have a co-insurance of 50% for any of the services you obtain after you meet the deductible. So the scenario is this. Consumers come in and they say, you know, I didn't even come close to meeting my silver level deductible. I think I should explore a Bronx plan. And of course, through our first year, we were always kind of hesitant to even go through the Bronx plan options because it's a little scary, there's a higher deductible, but it may make sense to some clients to consider it. Again, these are usually people who are relatively healthy and have low medical needs. You do want to ask them, obviously, how much they spent or accumulated towards the deductible the previous year, right? Because if they did meet their deductible, then obviously going to a Bronx plan from a silver may not be the best thing depending on their needs. And you want to compare that amount, obviously, with the premium saved if they were to select a plan. So here's an example. Husband and wife are relatively healthy and are not eligible for cost-sharing reductions. And the reason why I'm saying, you know, if they're not eligible for cost-sharing reductions is obviously you want to select a silver level plan if you are eligible, because chances are you will get a better deal in regards to the deductible. Last year, they accumulated $1,200 toward their $4,000 deductible for the standard silver plan they had. So here, we did the math. So the silver plan, the cost for a couples plan is $870 per month. It's $10,440 per year. They paid $1,200 in deductible, meaning they didn't even meet their full deductible. So last year, they ended up spending with premiums and deductible $11,640. They expect to have a similar usage this coming year. So if they go for a Bronx plan this year, it's $705 for a couples plan, $8,460 for the year in just premiums. They're projecting to have a similar deductible, $1,200, right? If you add the $8,460 plus the $1,200, their total medical cost and premiums and deductible would be $9,660. With that logic, a Bronx plan makes more sense, right? Because you can use part of the premiums that you would have paid in the silver plan to go ahead and actually pay for the deductible that you may end up using. I hope that example gives you an idea, again, of when to consider or compare those options. Obviously, if you're going higher, then as long as the client is aware of the differences, you should be fine. And give me 1 second. We're actually going to have Alex do the following part. And this was in request to last month. So let me just put the issue in perspective. So you have someone who is pregnant, and there's different circumstances, right? They may come to you and be uninsured, or they may be eligible for Medicaid, or you just have to explore all their options. The specific issue that we had was when the newborn, when the child was born and mom was already on Medicaid, the marketplace should have allowed that child to automatically pick a plan, and it didn't. So based on your request, we have Alex, who is a fellow here at CSS, and she did some research in exploring the health insurance options for pregnant women and newborns. So I'm going to transfer it to Alex, and she's going to do the next part of the presentation.
Okay. Hi, everyone. My name is Alex Burke, and just like Carolina said, I'm going to go through and talk a little bit about options for pregnant women, basically with an eye towards how navigators can advise them to get the best coverage for themselves and their children. So as you can see from the slide, just starting with the idea of if a pregnant woman is currently uninsured, here's 3 options for them. Some of this may be a refresher, but it's always good to think about it through this lens. First, always good to remember that pregnant women are eligible for Medicaid up to 223%. So that's a great thing if they're in that. And basically, if a pregnant woman is enrolled in Medicaid, even if it's just because they're at 223, they're still enrolled into a managed care plan. So they're not getting some sort of different Medicaid plan. They are just enrolled because they're income eligible now. If a pregnant woman is enrolled into and so that's important, like I say on here, that basically it's just good to keep track of what doctors are in the network, and we're still advising these women to make sure that their doctors are in whatever network for the plan that they pick. Now, for QHPs, we have to keep in mind that how to count their family size and what APTCs they might be eligible for, but also pregnancy is not a special enrollment period. So if an uninsured woman comes to you and wants to get insurance and she's pregnant, that doesn't necessarily mean if she's not in an open enrollment period or there's not another reason for her to be enrolled at that time, pregnancy is not going to create that special enrollment period for her. So that's something to keep in mind. And for employer-sponsored insurance, we're going to want to advise women to talk to HR about their health options and what their enrollment deadlines are. So moving on to think about it from the perspective of the newborn. Basically, we're talking here about newborns whose parents are enrolled in the QHP, but they don't have APTCs, so their income is above 400%. And that's who we're focusing on here, because if they're at 400% or below, their children are going to be enrolled into Child Health Plus, not into the QHP. But it's important that parents who are enrolled in the marketplace, they can enroll their children into their QHP within 60 days of birth. And if they're enrolled within those 60 days, the coverage is retroactive to birth. So like we mentioned at the bottom here, if a woman is pregnant, her household size is going to expand. So maybe she was at, 420% of the FPL, and now she's going to fall below and start getting APTCs, and her kid is going to be enrolled in Child Health Plus. So that's something to also be thinking about when these women come to you for advice. And this is something that Carolina mentioned, talking about newborns whose mothers are enrolled in Medicaid. If a mother is enrolled in Medicaid, her child is presumptively eligible from birth until their first birthday. So you should be adding the newborn to the mother's marketplace account no later than the end of the month following their birth, and they will be automatically enrolled into the same managed care plan that their mother is enrolled in. Now, if the family wants to put the baby onto a different plan because maybe their doctor, the preferred doctor, is not on the same plan as mom, they should be allowed to switch plans for the newborn within 90 days of enrollment, just like anybody else. But if you experience trouble with this, then you should definitely let us know. But that is what should be happening. Now, if there's a newborn whose parent is enrolled in employer-sponsored coverage, you have a little bit of a kind of balancing game to see what's going to be most affordable and useful for the parent. So, because basically, if the client's employer-sponsored insurance includes dependent coverage, then they can enroll their child into the plan within 30 days of birth. And if they're enrolled within those 30 days, the coverage is retroactive to birth. So it should pay for the costs from that the baby incurs during birth and within those first 30 days. And it might be worth it for your client if they're wondering, how are we going to pay for the child's costs, to talk to their HR department and understand can they enroll their child up to that 29th day so they can have some time to see what kind of cost their child incurs and if it's useful for them to just enroll in Child Health Plus, or should they just go ahead and enroll the child in the employer plan. Another question for the Human Resources Department is to see if enrolling the child into the employer-sponsored plan locks them in for an entire year. Because if they're locked in for the entire year, they're not going to be eligible to disenroll from the employer-sponsored plan and then enroll into Child Health Plus, which might be cheaper for the family. Whereas if they are eligible to disenroll, it might be useful for a parent to enroll their child in the employer plan for the first month of the child's life so that the plan pays for all costs associated with the birth, and then disenroll the child from the employer-sponsored plan and enroll them in Child Health Plus afterwards, because that might be cheaper moving forward. It's kind of a lot of information, but just kind of that's how we want to be thinking about it for parents. So if we do have the situation where the child should be enrolled in the employer-sponsored insurance, or wants to be enrolled in the employer-sponsored insurance to cover the first cost, but then wants to enroll in CHIP later, it's important to keep in mind that there is no waiting period for children to enroll in Child Health Plus if they're at or below the age of 5. So a parent can drop employer coverage, disenroll them from their employer coverage, and then enroll them in CHIP. But it's important that we keep in mind when we're advising people that if you want to make sure that you do this all before the 15th of the month, because, and we'll get into this later, but if you drop a child from the employer plan, on the 16th of the month, and they're no longer covered, they won't be covered until the first day of the second month. So we don't want to advise someone improperly and end up missing a month of coverage. So that's another issue to keep in mind. And once the child is enrolled in CHIP, they are enrolled for 12 months, and they can switch plans throughout the year. But again, they have to disenroll from one insurer and enroll in another. So it's the same question of timing that we want to keep in mind. So part of why we're talking about this is just that, Child Health Plus coverage is not retroactive to the date of birth. So if a child incurs costs during birth or the first weeks of life, if they have medical needs, then those will not be covered by Child Health Plus. And as I mentioned, and it's outlined here, if the child is born before the 15th of the month, the coverage will begin the first day of the following month. So, for example, just using January, if they're born January 6th, they'll be covered in Child Health Plus starting February 1st. But if they're born after the 15th, then their coverage doesn't begin until the first day of the second month after birth. So if they're born January 26th, their coverage begins March 1st. And so I'm going to talk a little bit about ideas for parents who are going to enroll their children in Child Health Plus. Are not able to enroll them in Medicaid. They're not eligible for employer-sponsored coverage, and they need to figure out how they're going to pay for those first few weeks or up to over a month of the child's life. So one thing is to request financial assistance from the hospital in advance. So if the mother knows where they're going to be delivering the child, she can in advance request financial assistance, but that doesn't cover doctor's fees. So and that's not going to be a cure-all for everything. And that's something to keep in mind. You can also, if the mother doesn't do it in advance and after birth finds that she's that the child has incurred a lot of medical bills, you can apply for financial assistance afterwards. And there is a one-pager. Then I know that link looks a little scary, but it's on our portal. And you can also contact me about this as well to help figure that out. Another thing to keep in mind, and this is something that we've had some luck with once, but is not a guarantee. But basically, if you have someone come to you who said, their child had to be in the NICU or something for the first few weeks, and they have just extremely high medical bills from that period, we've had some luck with advocating with the marketplace to advocate with the plans to enroll a child retroactively. And it's not something that they have to do. People don't have a right to get their Child Health Plus retroactive to birth, but it is something that I know has happened at least one time. And if you have someone who is just, facing a lot of problems and you want to try to advocate for that, it's something that's worth trying. So those are our strategies for the uninsured period. And so that hopefully gives a good sense of kind of how to think about if a pregnant woman comes to you looking for coverage for her for the newborn, kind of how to think through advising her. And I just wanted to go ahead and, while I have you all here, talk about a new resource for CNN clients, and that's me. So as it was mentioned, I'm an Equal Justice Works Fellow here at Community Service Society, which means that I've been funded by the law firm Case Scholer and Pfizer to work here for 2 years doing a variety of things, but also specifically focusing on individuals who are chronically ill and have to switch insurance between Medicaid and marketplace insurance and don't want to have their care disrupted. So if you have someone who's coming to you to enroll and, they were on Medicaid and maybe they made more money this year and they're up at, 150% of FPL or something, and they are coming to you with a list of doctors and they're just like, how am I going to figure out how to get all of these people who I need in my plan, or a list of drugs, or you know the drill, then I hopefully you can refer them to me if you want, and I can help advocate for them to kind of make sure that they're getting the best, the cheapest care available to them, and that they're trying to get all their coverage as they move forward. So if everyone, I'm a resource to you guys if you don't want to refer a client to me, but you want to just ask me a question, anything. My information is on this slide, and also Carolina definitely knows how to get in touch with me. So hopefully I'll hear from you with questions you have moving forward. So thank you.
Thank you, Alex. And with that said, I think we can all probably unload a few cases to Alex and say, I have a client who needs to explore a QHP to make sure that their providers and prescriptions are within network. So feel free. I mean, here at CSS, we're very lucky. We get very talented individuals like Alex who come in with a specific objective, and it's all obviously related to health insurance. So again, feel free to contact Alex if you don't remember and you want to email Leon or myself and say, I do have a client who is no longer eligible for Medicaid, and there is a concern that there may be a lapse in coverage, or there may be an issue with a transition in care. Again, Alex is here as a resource, and she can help with that. We're going to move on to marketplace updates. So by now, I am assuming that everyone is familiar with the anonymous shopping tool. Hopefully, it's working for everyone. I did notice today that Empire Blue Cross, at least for the Westchester, was not showing standard plans. So I'm hoping that that was just something random. one of the things that we heard from other navigator agencies and the state is that if you want to print out a plan comparison chart, then you want to use the anonymous shopping tool. If you go into the plan selection through the client's portal, when you hit the print function, it may not be printing properly. But if you go back into the anonymous shopping tool and you know the products you're looking into, remember you can select up to 3. And this is kind of like a really neat way to be able to display the different, hopefully the client has narrowed it down by this time, the different plan options. And if you notice at the bottom where it says design, it will let you know some specific information about the plan, and you know, eventually you might become familiar with that, and it's just boilerplate language in general. But whenever you see something like longer, then you want to pay attention. Maybe there's some additional benefits and so forth. And again, it's kind of neat because it gives you the premium and it gives you the basic information that someone would need to know. Let me move on to the next one. So I want your feedback on this slide. And so you've probably had clients who come in and you may have the same plan name, same metal level, but there's a slight difference in price, right? So for example, you have here Health First, and the plan is a standard silver, and the monthly premium is $391 with 34. And then you have here Health First as well. It's a silver and it's standard, and you have a $387.46. So it's like a $3 and change difference, right? So clients will say, well, what's the difference? And the only difference that I have been able to spot, and again, submit your comments if you know if there are any other differences, is the dependent option, right? So the one that is slightly more expensive, like $3 more expensive, is the dependent up until age 29. And I think last month, I want to clarify, Greg mentioned that it's actually this option is up until age 30. That is correct. So it's up until age 30. You have to be under 30 pretty much to get this option. Remember, the dependent coverage to age 29 is a state law. You can look at the Department of Financial Services, and there's specific requirements, like you cannot be married, you cannot have access to other health insurance. The dependent up until 25, which is in essence up until 26, it's broader. It's federal law that if you have dependents under 26, you can add them to your plan. So again, so far the only difference that I have been able to see and explain to clients is that dependent. So if the client does not have any dependents that would benefit from this, because maybe the kids are under Child Health Plus or minors, then you want to go obviously for the cheaper option. There's no reason for you to go with the dependent 29 and pay $3 more. Again, submit your comments if you know there is another difference that I am not identifying. In terms of the benefits and descriptions, I went through each tab and they were both the same. So again, that was the only difference that I was able to identify. That doesn't mean that that's the key difference or there are no other differences. Renewals for mixed families. So this is important to keep in mind. So the state decided that they want to pretty much sync an entire family to a similar renewal date. So maybe last year you had someone who applied for a QHP, let's say in March, but their child obtained Child Health Plus in January. So based on those 2 dates, you may have different potential renewal dates, or I should have said the other way around. CHIP in March, QHP started January. So you would expect that obviously the QHP has to renew by the end of the year and that the child would get a renewal by March. When you have mixed Child Health Plus QHP status families, they may have the same renewal, which means that they would have the same renewal date of December 15 for January 1st coverage. What happens if the QHP does not renew? Well, they're going to be dropped. but the child in Child Health Plus will not be dropped. They will stay, let's say in that case, up until March and finish out their 12 months consecutive coverage. And at that point, they would have to renew in March. Again, the idea is to sync the entire family to the same renewal date. So keep an eye out. I know that some people mentioned today during the call that precisely QHP, we're not getting renewals, so that is definitely another issue. But when you're seeing that the child also has to renew, and you know that they started their coverage later on, know that they may in fact have to renew because the state is trying to sync the entire family to the same renewal date. Maximum out-of-pocket. So like the deductible in an embedded standard plan, the maximum out-of-pocket can be reached individually. So we've learned everything about the aggregate and embedded deductible, right? So in a deductible, you may have in a silver level 2,000. For a couple, it would be 4,000. Or for a family, it would be 4,000. If an individual reaches their individual deductible, like the 2,000 because they incurred medical expenses, then the plan can start paying. They don't have to reach 4,000, right? So the same logic applies to the maximum out-of-pocket. It can be reached individually. So again, husband and wife have a maximum out-of-pocket of 11,000. The individual maximum out-of-pocket is half of that, which is 5,500. Husband has a car accident and is hospitalized and incurs medical bills that reach over 5,500. Husband's maximum liability will be 5,500 and not 11,000, right? So in that case, because the same person incurred and met the individual maximum out-of-pocket, then they're set. They don't have to meet the 11,000. Again, it's similar to the embedded deductible. And if your clients want to know where that information is at, if you look at the standard cost sharing design form, and again, this is for standard plans. I'm not going into the non-standard plan. You will be able to see it. On the last page, there's always this very fine print, which I've highlighted. So it says here, each family member is subject to a maximum deductible equal to the single deductible and to a maximum out-of-pocket limit equal to the single out-of-pocket limit, right? Once all family members in aggregate meet the family deductible, then or maximum out-of-pocket, then no family members need to accumulate any more dollars towards the deductible. So again, you can meet your maximum out-of-pocket individually, and then the plan will pay the rest. On the application, when you have a returning client and you're rerunning the application because maybe you have to update information, the client will be asked, you currently have health insurance. And, you know, you might be re-enrolling the client because, yes, they had a QHP. You can go ahead and say that the client does not have health insurance in order to move forward. That was more or less the advice we got from the state. I know I've been doing it. I'm not so sure if it's still the correct way, but you know, the common sense guideline is that when you're going through the application of someone who had a QHP and maybe their QHP is still active for the month of December, you can go ahead and say that they do not have health insurance in order to move through the application. The no declaration of income form, again, I talked a little bit about this. It has to be used as a last resort, and I think I went into this already, so I'm going to skip that. Case reporting form tips. So I had a conversation with the state, and you know, I feel horrible when you guys submit urgent cases and I cannot get a fast turnaround, because I know that those are your clients and that they have unique urgent needs, and we submit them to the state and hope for a response. So I had a conversation yesterday with the state and explained that obviously my objective is to make sure that there's a fast turnaround, and that I needed to also help out in making sure that I did everything I can along with our navigators to help expedite the process. So the state gave me some tips on how to hopefully capture the cases that we're going to be submitting to them for them to be able to process them a lot faster. With that said, it doesn't mean, again, that you're going to get a response the next day. It may take several days. So here are just some general tips. When submitting cases to CSS for the state's review, make sure you have tried getting a solution through the marketplace and account review department. I told the state that, of course, our navigators will first try the marketplace and the account review department to get a solution, and that they only report cases after they failed to obtain a solution through that medium. So I definitely pushed back on that, and I said, no, I'm very confident that our navigators are doing that. The next thing that should become of habit, especially if you think it's going to be a case that is going to give you trouble, is try to obtain a tracking number. And the reason why you want to obtain a tracking number and report it to us is because in that case, it is easy for the state to go back and pull up that tracking number and check the status, as opposed to having to generate something else and create greater confusion. The other tip is that the case note should have sufficient information to identify the type of issue, and this should be at the very beginning. So sometimes I get wonderfully written notes, and they're great notes in general, but I even have a hard time identifying the specific issue, and sometimes I have to touch base with you and ask, okay, what was the issue at the end? What's outstanding? Because obviously you've invested a lot of time in this case, and you know it back and forth that you might provide a lot of information, but I may still be missing the relevant information. And when you are going to be reporting cases, try to think about the following categories of issues. Like, you will encounter system issues, like technical glitches. You want to describe where and when the error occurred. For example, the application showed an error message after inputting the client's income information. The reason the state said that it's important to describe when or at what point the error occurred is because from their end, when they're reviewing our cases, they can pull those out and send them to the right people to report that issue, and they can be specific enough to track any trends and again, try to fix it. When you have document review, I think most people are pretty patient, and you've learned to gauge how long it takes. Obviously, if you have an urgent case, you want to send it to us. One of the tips is to describe the documents that the state requested and the ones the client submitted, and explain a little bit of why that satisfies the request, right? So, for example, client uploaded the last 4 pay stubs of her current job and the unemployment letter. This is all the income she currently has and expects to have in the upcoming year. Again, if there's specific documents that you're uploading, explain what documents you uploaded. First, explain what was requested, what you uploaded, and why that satisfies the state's requirement, right? As we all know, we hope that that satisfies the state's requirements. But at least when the state gets our cases, they can pre-screen them quickly and let us know if we're missing something or there's other information that they need from us in order to process. Another category that it may create a little bit of confusion because we know about life-change events, but the life-change event that I'm referring to here is, someone changes, date of birth should not change, but Social Security. So you report those if, for example, there is a confusion about Social Security number. What I asked previously, you want to check to see, are there different last names being used? I think it's important to include that information in order for the state to quickly figure out what may be the potential issue. And the last category, which is probably one of the most common, or at least during the special enrollment period was very common, is the coverage category, which includes any loss of coverage. For example, client's husband became Medicare eligible and lost coverage after disenrolling from a couples plan, or the client has a loss of minimum essential coverage, SCP, and should get coverage the first of the month, right? So simple but detailed enough for us to be able to identify the specific issue. Again, the cases that you report to us go to the state, and the state has to delegate them to different people depending on the type of issue. And when we don't have enough information, we just end up with this back and forth. And again, I'm wasting your time, and obviously the main concern is the client's time. So we want to make sure. The other thing is you want to set clear expectations with the clients in terms of the turnaround. And obviously, if you have medically urgent cases, you want to let us know. The state will prioritize those, and they will bump them up in their list. The one thing that created a lot of issues, I think, in the last few months were clients seeking retroactive coverage. So you want to make sure that the client understands that you can, in fact, request retroactive coverage, but that you cannot guarantee a fast turnaround on that request. Meaning that if they wanted, let's say, November 1st coverage, and through their application the system incorrectly gave them a December 1st coverage, that you're going to go back and ask for November, and they're going to be liable for any premium for November. But they may not hear that coverage went retroactively. Gosh, I've seen even 2 months, depending on the issues, the communication, and backlog. And so what has been happening is that in hindsight, once retroactive coverage goes in and the client gets a bill for that 1 month, the client says, well, I didn't use it. Why should I pay for it? And that's kind of also unfair to the plan in the sense that had the client incurred medical costs, the state would have gone back to the plan and said, you are going to issue retroactive coverage. We need you to do that, right? And so we cannot ask for retroactive coverage and then have the client say, never mind. It's a risk that they have to take. It's really a question, do you want to protect yourself for that 1 month? It's unfortunate that you're not going to be actively using your coverage because you probably won't have an insurance card active for that month, but it's more of a protection. And they need to be clear that, you know, the turnaround, it can take weeks, so you might not hear. So you may potentially be paying for that month to have that extra protection in case something does go wrong. But they need to commit to that, because what ends up happening is, you know, the marketplace sends the request eventually goes through, the client is very disappointed and upset, and now we cannot, like, win. We don't win with the client and we don't win with the state, right? So make sure those are clear expectations. Database reminder, all your enrollment casework has to be entered by the end of the month. This is for navigators. For New York State Health Foundation, you have until the 5th of every month to enter all your data. I ran data for October and November and noticed a small number of agencies, which I will not mention here, and I didn't find any data entered for October and November. I'm going to rerun the data to make sure that I did it correctly, and I'm going to ask Jonathan to verify my data. But it is super important for you guys to enter your data on time. Now, right now, if you ask me, well, should I prioritize clients over data entry? Gosh, like, yes. But at the same time, I might have to email you and say, if you're not going to be up to date with your data, I need an estimate, because we are generating monthly reports and we are being a little more strict this year in looking at how we're doing, not only by individual agency, but as a network, right? So we're a team and we need to be able to account for everyone's work on a given month, because at the end of the month, I know that Nora and I are asked, like, how is CNN doing? And if I see zero data entered for some of those agencies, that's on us to make sure that that is not happening. So again, but overall, congratulations. You guys have been doing a fabulous job in entering your data. Monthly state report. Moving forward, hopefully you will no longer have to see, and I'm saying hopefully, the Survey Monkey, which can be a hassle to complete, and obviously I sometimes have to harass you to complete to complete it. We're going to be sending out instructions. Our contractor for the database is doing some revisions to the reporting feature. So some of the questions that we were asking on the SurveyMonkey, like how many days were you open for services and so forth, those are going to be submitted through a special feature function on the database. And based on the information we have, we would be designating one person from your agency, like you will let us know who that person would be, and we would give that person access to that reports feature, because obviously we don't want multiple navigators submitting a report for the same agency, and we want to be able to follow up with the right person who should be submitting those reports. So those instructions are forthcoming. That is it. We're going to check and see if you guys have any questions. For next month's monthly meeting, I believe Kyle will be going over the individual mandate tax form, so it should be fun. So we do have a few questions, and I feel bad that we didn't stop at any time. Okay, so first question, can a couple where one is going to be eligible for Medicare in 2015 enrolled as two individuals instead of a couple to get around the new deductible? Gosh, I don't know. And whoever asked this question, Marsha, so that's a great question. You know, one of the things that people were supposed to be able to do was to be able to select different plans and still have the same, obviously, APTC amount applied. But from a practical perspective, that was not happening. I'm going to take note of that and explore that question. That could be a clever solution. So the idea would be to create two different accounts. Yeah, I don't know if anyone else has any thoughts about that or the challenges. But so I will take note of that.
Well, sometimes when you enroll in a couple, it will give you the option to pick an individual plan per person, which is usually a little bit more expensive.
Okay.
Versus a couple plan, which would be, the premium would be a little bit more, a little lower.
When you had 2015
So Leon is saying that you might be able to do it, but you may have a higher premium if you go at it individually versus a couple. So at that point, you would have to look into like what would be the deductible like and what are the pros and cons. Let me see if I can find you an answer as to if there are any concerns about doing that aside from the price that Leon just mentioned. What if the individual has no assets and is above 55 of age? Will there be a lien on those who support him or her? No. So the lien is it's based on the person who is benefiting from it. So if you are married, then there may be. So remember that if you're married, you hold your assets jointly, right? In general, so let's say one spouse uses Medicaid, the other doesn't, they will they will look into any assets that that person who benefited has access to or entitled to. I hope that helps. So this may be a question or comment. It would be helpful if New York State of Health added a bullet that states that individuals who receive Medicaid through the marketplace cannot be subject to the lien because they cannot obtain long-term services through New York State of Health. Okay, let's see if we can get that. Give me 1 second. Or at minimum, explain a little more. The language seems obviously confusing for most clients. Does the individual need to meet all three requirements? I am assuming that this is, Arlene, this was your question. I'm assuming that's the The joint filing, yes, all those requirements have to be met. Separated for 6 months, have a dependent child, the person files taxes and supports that child for at least half of the year. So I think I'm going to skip this question and come back. Okay. So Renata had a couple of questions regarding people who are self-employed and don't qualify for unemployment benefits. How do they prove they have zero income? So they have to, it's not proving that they have zero income, it's proving how they're supporting themselves. So, and it's the same thing, right? So someone has to show that, someone necessarily doesn't have to show that they have zero income. When you have no income, you can state, I have no income. The question is then, how are you supporting yourself, right? So it could be through their own letter that they say, I am using credit cards or whatever they're using to support themselves, or it's a letter from a family member or friend that says, I provide food and shelter. So I hope that helps. Again, when you think about the question in reverse in terms of like how are you supporting yourself versus you have no income, improving that, that may help a little. I thought letters of support were no longer required. They're supposed to be able to just self-attest. The information I got was directly from our contract manager, meaning that as a preference, they would prefer, obviously, a letter of support. As I mentioned, they can attest, but if you are able to obtain it, I think it carries greater weight, again, especially if the person cannot account for how they're supporting themselves, right? Like maybe they don't have any retirement accounts that they're tapping into or any other types of support they can reach out to, and they're being supported by a family member. That should help. Let's see, give me 1 second. For CSS purposes, when we enroll an applicant who is pregnant, does this count as one enrollment or two? It's going to count as one enrollment when the newborn is born. When the child is born, you add that child, and that would be your second enrollee. But that's a great question. So eventually you will get credit for that child.
But you will have to add.
You have to add the child. Mm-hmm. For people with APTC, when the child is born and depending on the date entered in the system, the newborn will be without coverage for many days. What is the parent to do? For someone who's getting APTCs, actually if you're getting a QHP, the parent, obviously, depending on whether it's open enrollment or special enrollment, has a special enrollment period of up to 60 days. And for a QHP with or without APTCs, coverage goes back to the date of birth. So just FYI. I mean, there may be some time when that is being straightened out by the insurance company, right, because they have to go back and provide coverage, but QHPs go back to the date of birth. Child Health Plus has been the issue, and as Alex mentioned, in very, 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 and I mean very exceptional circumstances, the state may be able to do a workaround and ask a specific health plan to provide coverage from the date of birth. But we've only seen it once, and I know I've reported several cases to the state, and they just have not been compelling enough, which is unfortunate. I think we need to do some advocacy on that end because that would solve so many issues. On the anonymous tool today, if you filter by Empire in New York County, you get no results. So I'm afraid there was something wrong with Empire. We'll report the issue regarding the anonymous shopping tool. We'll check to see if anyone has any questions. Again, we are during open enrollment, so our objective is not to waste your time. And you should try to get lunch if possible. Let's see. I think we may just have a couple of hands raised, so we will attend to those, and then we will.
Hi, Joyce. Good morning. Well, good afternoon.
Hi, Leon. Hi, how are you? I actually raised my hand accidentally, so I'm all good.
Okay.
Thank you.
All right. Okay, we have Renata.
Yes. Oh no, this was an old raised hand. Never mind.
Okay.
So I am just gonna ask around. I think we're done. Again, thank you very much for all the work that you guys are doing. Make sure you do a little self-care. You know, if things are slow in your area, give us a call and we can brainstorm. I don't remember if it was Star from Cal and Lauren mentioned a strategy. So under the old FE program, I remember that we used to call former clients to remind them about their renewal. So if you are experiencing a slow turnout or you have time, especially prior to December 15 and obviously prior to February 15, if you want to focus your efforts on your QHP clients and see whether you know it would be worth giving those clients a call or sending them an email. A call may be best in the sense that hopefully you can reach them and let them know that you're following up. You notice that they haven't renewed their insurance and that you're available. I do have to say, for confidentiality purposes, they have to be your client. So you cannot generate a list and give it to someone else per se and say, or much less give access to someone else to your account for someone to do that. Hopefully that won't take a long time. We wish the dashboard was a little more user-friendly because you would have been able to sort by QHP, renewal dates. It's not happening, right? You may be able to use the CSS database, however, and get a list of potential clients. But it may be easier at this point to browse through your list, and you might trigger names and then quickly check on the renewal status, specifically if they're a QHP, because the concern is that if they don't renew during open enrollment, they may not be able to enroll. For Medicaid, you obviously want to make sure that they enroll, but they always have the opportunity to come back and re-enroll. So again, you could do your own individual outreach through your own dashboard if you feel things are slow. If you are overwhelmed, let us know so, again, we can coordinate things and hopefully help each other out as a network as we go through this peak season. And make sure, obviously, you're all doing your best. Remember that after open enrollment, things slow down a lot, so definitely take advantage of every opportunity to get as many people enrolled during this peak time.
And just a final note, we will be referring cases to you guys unless you tell us that you cannot handle them, that you cannot, that you are at capacity. So if you are, let Carolina know.
And I think just someone raised their hand. Angelica, do you have a question? Okay. Okay, so everyone, again, thanks so much. Hopefully you can now go grab lunch, and thanks for all your time. We will stay for like the next 5 minutes here in case anyone has any questions. Remember that we cut short our case rounds, so we will just stick around in case you have any questions. Raise your hand and let us know. But again, everyone is free to go at this time. Thank you.